Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of fibroids. So if the patient is asymptomatic patient, then fibroid is an incidental finding. If it is an asymptomatic fibroid, then the fibroid is seen as an incidental finding. So here we should do expectant management irrespective of the size of the fibroid. We can do expectant management irrespective of the size of the fibroid. Expectant management is enough in perimenopausal and postmenopausal women even if the fibroid is symptomatic. In perimenopausal women who are more than or equal to 45 years of age with complaints of excessive bleeding, then the next investigation is endometrial biopsy in order to rule out endometrial carcinoma. Conditions where asymptomatic fibroid should be removed includes if female with recurrent abortions without any cause other than a fibroid, in case of infertility without any cause other than a cornual fibroid or any other fibroid, if there is subserous pedunculated fibroid which is likely to cause torsion, if you are not sure about the nature of fibroid, that is if there is sudden increase in size of the fibroid. So in all these cases, asymptomatic fibroid should be removed.
thank you and thank you for watching.